Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the external hemorrhoids and other rare disorders of rectum and anus. Hemorrhoids are the varicose veins present in the anorectum, originating from the plexus formed by the radicals of the superior, middle and inferior rectal veins. The hemorrhoids may be external or internal. The external type is covered by skin and the internal type are covered by the mucous membrane. If the two types are associated, it is called intero-external hemorrhoids. External hemorrhoids comprise a conglomerate group of distinct clinical entities. Acute external plexus hematoma. It is commonly called thrombotic pile. It is a small hematoma occurring in the perianal subcutaneous connective tissue. It is usually superficial to the corrugator cutis ani muscle. It is formed due to the bursting of anal venule upon straining of stool, coughing or lifting a heavy weight. It appears suddenly and it is very painful. On examination, a tense, tender swelling which resembles a semi-ripe black currant is seen. The hematoma is usually present in the lateral region of the anal margin. It is not treated, may resolve suppurate fibrose and give rise to a cutaneous tag or burst and extrude the clot of continue bleeding. In a majority of cases, resolution and fibrosis occurs. If it is seen within 36 hours of the onset, best treated as an emergency. Under local anesthesia, the hemorrhoid is bisected and the two halves are excised together with half an inch of the adjacent skin. This leaves a pear-shaped wound which is allowed to granulate. The relief of pain is immediate and a permanent cure is certain. On rare occasions in which a perianal hematoma is situated anteriorly or posteriorly, it should be treated conservatively because of the liability of a skin wound in these regions to become anal fissure associated with the internal hemorrhoids. Intero-external hemorrhoids. It is the varicosity of the internal rectal plexus, but as communication between the internal and external rectal plexus, former become varicose, the latter is liable to become involved. Dilatation of the veins of the anal wedge, it will become evident only when the patient strains. When a blue cushion-like ring appears, this type of external piles is almost a prerequisite of those who lead a sedentary life. The only treatment is the adjustment in the habits of the patient. A sentinel pile. It is associated with the anal fissure. Conditions simulating external hemorrhoids, anal warts, condyloma and hypertrophic tuberculite of the anus. Hypertrophied anal papilla. Anal papilla occurs at the dentate line. This is the remnants of ectodermal membrane that separated the hindgut from the procterium. These are common in majority of the people. Anal papillae can become elongated in case of anal fissure. Sometimes the elongated anal papilla may be the cause of a pruritus. In elongated anal papilla associated with the pain or bleeding at defecation is sometimes encountered in infancy. At any time of life, a hemorrhage into a hypertrophied anal papilla can cause sudden rectal pain. Prompt examination sometimes reveals blood clot being extruded from ruptured papilla. A prolapsed papilla may become nipped by the contraction of the sphincter mechanism after defecation. It is possible that repeated traction on the pedicle of an anal papilla results in an anal fissure. Treatment: a slotted proctoscope is used. Elongated papilla without hemorrhoids should be crushed and excised after injection at the base with local anesthetic. When elongated papilla complicate internal hemorrhoids, it is an indication for operative treatment of hemorrhoids as well as excision of the elongated papilla. The other diseases of the rectum and anal canal are proctalgia fugax. This condition is characterized by the attack of severe pain in the rectum, repeating at regular intervals and apparently not related to organic disease. The pain is described as cramp-like, often occurs when the patient is in bed at night, lasts only few minutes and fades spontaneously. It may follow straining at stool, sudden explosive bowel action or ejaculation. It occurs more commonly in patients suffering from anxiety or undue stress. The pain may be unbearable. It is possibly due to segmental cramp in the pubococcygeus muscle. It is unpleasant, not curable, but luckily harmless and gradually subsides. The other disease is anal warts. These are usually multiple and present the same characters as warts elsewhere, sometimes accompanied by gonococcal proctitis. Simple warts respond well to treatment by application at weekly intervals of 25% podophyllin in liquid paraffin. After 3 or 4 applications, any residual warts should be excised. One more disease is condyloma. Condyloma have smooth surface and are more pedunculated than the anal warts. They are moist with a glairy discharge. Hypertrophic tuberculoid of the anus. These are multiple yellowish brown papillomatous excretions. The diagnosis is seldom established until microscopic examination has been undertaken. That's all about the external hemorrhoids and rare diseases of the rectum and anal canal, and in the next video I will discuss about some other disease. Thank you.